Hey guys, my name is Jeff and I'm a third-year medical student. I want to share with you things about how to help your family member not get hurt by drugs. Things that you can do to help your grandfather out, your grandmother out, yourself out if you're taking a lot of medications, your family members, because it's something that I don't think gets done enough. And that is double checking your medications. Sometimes, for whatever reason, the interactions between the drugs, they don't get checked. Now in the case of my loved one, she had a doctor who I think was just flat out careless. But in other cases, I don't think that's the case. I think it's just there are different reasons, and I don't mean this as a criticism on any doctor except for my loved one's doctor, who I think really was careless, and this is kind of what drove me to make this video. In the case of her doctor said that she had vertigo or problems with her inner ear, that she had a migraine because she said she had more serious headaches, but for some reason he just assumed that she had a migraine, so she gave him a migraine medicine, a medicine for vertigo, or her sore throat, erythromycin. And the reason why he gave her erythromycin instead of penicillin is because she's had penicillin in the past. It didn't seem to work very well. But one of the things he didn't do was look to see if there's any interactions between the drugs. And so it turns out that in one of the medicines he gave her, there's an interaction between ergotamine and erythromycin. And so ergotamine is, I believe, a vasoconstrictor. It's for migraine medicines. And if you combine that with erythromycin, you can get some very, very dangerous interactions of peripheral ischemia, where the blood vessels start to shrink up. And you could also get cerebral ischemia, which is your brain doesn't get enough oxygen. So I was skeptical of this doctor in the first place because she's healthy. She just has a little sore throat. Her dizziness is probably because she's slightly anemic, and she has headaches, but not very often. She does not have auras. She doesn't experience nausea or vomiting when she experiences her headaches, but so I don't think they're migraines. I was skeptical of her doctor. And then I was also skeptical of taking all these antihistamine medications, these migraine medications, for what, right? And so I plugged it into my program, Epocrates, which is a drug program, but there's also micromedex, which I think is very helpful, and a whole bunch of different ones. So I'm not endorsing any particular brand, but I plugged it in and found that there's a FDA black box warning for ergotamine. You're not supposed to use that for erythromycin. It can lead to serious or fatal events. It really hit home to me because if I didn't know about Epocrates or micromedex or all these things that I do and the doctors that I work with do in the hospital, if I didn't know that medical errors are often happen because of carelessness or because of, I'm sorry, they're not usually because of carelessness, but in this case it was because of his carelessness. They're usually because of other things, like people well-intentioned, really hardworking, almost perfect doctors, but just sometimes, different events happen, like sudden changes, way swamped. This is not a video blaming people, and that's one of the things that the experts tell you, is that many of the mistakes we make are not because of people. It's more because of the the way the system is set up, like not having electronic medical records. And so when you read poor handwriting, you accidentally mistake it. So this is not a criticism of doctors or anything, but these errors happen all the time, and if you're lucky, nothing happens. Like if I wasn't there to double check or triple check her doctor in this circumstance, if we're lucky, she's not going to get any cerebral ischemia, she's not going to get a stroke, she's not going to die. And her doctor, when faced with this, will probably say, well, the chances are really small. But if this is your loved one, do you want to risk a 1% chance of your loved one getting an unnecessary stroke of cerebral ischemia? So the bottom line of this video is, please double check all your medications. Go to Google, type in these words. I will post up these these drug programs that you can check, and they do cost money, but I think $39.99 versus your loved one having to stay in the hospital, I personally think it's worth it. But at the very least, you can do Google checks and stuff like that.